Hello, and welcome to our pharmacy. Today, we'll be guiding you through a consultation for a new medication. Let's meet George, who has come in to pick up his prescription.
Hi, I'm here to pick up my new medication.
Hi there, I'm Luna, the pharmacist. Of course, I can help you with that. Please have a seat in our counseling area. It's a bit more private.
Thank you, I appreciate it.
Could I have your name and age, please?
Sure. My name is George William, and I'm 59 years old.
Nice to meet you, George. May I ask what brought you to see your doctor today?
I've been dealing with urinary issues and an enlarged prostate. My doctor mentioned there's been a bit of improvement, though.
That's encouraging to hear. I see that your doctor prescribed you Jalen. Did they explain anything about this medication to you?
No, not really.
No problem. To help you understand it better, would you mind if I ask you a few questions about your overall health and lifestyle?
Sure, go ahead.
Thank you. I see from your profile that you've been taking apotemsulosin 4 milligrams once daily for 3 months. Are you still on that?
Yeah.
And when did you take your last dose?
I took it yesterday after dinner.
Great. I also see you're taking Avodart. Are you still using that?
Yes.
When was your last dose of that?
I took it with tamsulosin yesterday.
Have you experienced any side effects from either of these medications?
No, none at all.
That's good to hear. Other than apotemsulosin and Avodart, are you on any other prescription medications?
Nope, just those two.
What about over-the-counter medications?
Sometimes I take Tylenol for headaches.
Got it. And do you take any herbal supplements?
Yes, I take vitamin D, 1,000 units every day.
Perfect. Any allergies we should know about?
No, I'm good on that front.
Do you smoke at all?
No, I don't.
And alcohol?
I don't drink either.
Thank you for sharing all this information with me, George. Can I take a couple of minutes to check some references, and then I'll be right back with you?
Yeah, sure, take your time.
Thank you for your patience, George. Based on my reference, your new medication is a combination of tamsulosin 0.4 milligrams and dutasteride 0.5 milligrams. It's basically the same treatment you've been on, but now it's combined into one capsule. So, instead of taking 2 pills, you'll just take 1.
Why didn't my doctor prescribe this combination pill earlier?
That's a great question. It's usually recommended to stabilize patients on each medication individually at the start of treatment. This way, any side effects can be monitored more easily. Once you're adjusted, switching to a combination pill helps with compliance and can reduce the number of medications you're taking.
That makes sense now.
I'm glad it's clearer. You'll want to take 1 capsule 30 minutes after the same meal each day. Since you've been on those medications separately for the past 3 months and have seen some improvement, you could notice even more benefits over the next 3 to 9 months. Just be sure to keep your regular visits with your doctor for follow-ups. And remember, even though you've been using those 2 medications without any issues, it's still possible to experience side effects now. Dizziness can occur, but it's usually mild and goes away with time. There's also a slight chance of some sexual dysfunction. If that becomes an issue for you, please don't hesitate to reach out to your doctor.
That sounds manageable.
I'm really glad to hear that. Just out of curiosity, how many tablets do you have left from your previous prescriptions?
I've got enough for 4 more days.
Great! You actually have a couple of options here. You can either finish up those 4 days and then come back to fill the prescription, or if you're feeling ready, you could start the new medication today.
I think I'll start the new medication now.
That sounds like a wise choice. It's all about what feels right for you. And please don't forget to bring those leftover pills to the pharmacy for proper disposal. We want to ensure everything is safe and sound.
Sure, I will do that.
Perfect. We'll give you a call to follow up and see how you're doing. It's important to us that you feel supported through this process.
That sounds good. Thank you, Luna.